So show me some of the techniques that you use on animals to help them.
Okay, the first thing I'll do when the dog comes into my office is observe him or her walking.
Okay. Do you want to do that?
No, let's
Okay.
not do that
All right,
because
you've observed, and what did you see?
we have Thurbert here,
Okay.
who's very oh, he's already ready to go here. I've observed him. I've looked if he's limping, if he's carrying a paw in a funny way.
And what are you noticing about him?
Right now, I have to move him around a little bit. Thurbert, stand up
And
for me.
I'm just holding him steady here.
You're holding him steady, and if you can just hold him straight.
Okay.
I'm going to examine his sacroiliac joints.
Okay. What do you feel?
I can feel that I have more mobility on the left than I do on the right.
So how do you rectify that?
All right, I'm going to show you.
Okay.
So this would be a sacroiliac adjustment. See how gentle it is?
Oh, it's wonderful.
Yeah, he didn't even notice. He knows I'm trying to help him.
Yeah.
And now if I want to check his lumbar spine out,
So
I'm
you're
looking.
putting your fingers all along his spine.
That's right.
Now he
Just
flinched
like
a little
this.
bit.
Because I found something here.
Okay.
And I can very easily treat that as I'm examining him.
How different is it from what you do on humans? Just the two techniques that you've shown us. Very similar?
It's much more gentle. My techniques on humans are very gentle. But if you can picture, an animal can feel a fly on its back, especially a big horse. They can feel anything. So this is a very, very light impulse.
And will that be maintained, or is the situation going to arise again once they get back out in the park?
Dogs like to play with frisbees.
Yeah.
They like to grab balls. They like to bump into things. They jump out of cars. They fall. So through general wear and tear, trauma, and so forth, these things can happen. Now, if an animal has a little injury and it stays with them, they'll compensate. That's when I see the differences in gait. The animal will sway, put more pressure on one side. So if I check out Thurbert's shoulders, that's another area where I might feel a difference.
And especially a dog that's got this kind of shape. There's a little bit more mass in the front. The legs are short. You know, there's got to be a lot of tension in those shoulders of his.
Exactly. In his case, there's nothing wrong with him right now.
Yeah, he's doing very
It's
well.
perfect. You see, he came to me when the way that
Wants to see his mummy who's over
mom
there.
Christina described it. She said Thurbert is getting up like an old man. Oh, that's how he's not
And how
climbing.
old is he?
He was 3 when he first saw me a few
gosh,
years ago.
yeah.
So for a 3-year-old to have those kind of problems, you'd think that it would have to be a geriatric.
So show me something else. Now, a lot of humans have issues with neck problems.
Yes.
Do dogs as well?
Yes. So if I needed to examine the neck,
Sort of move the collar around.
I'm moving it around now.
And I
would
guess
take
you
it
talk
off.
to the guardian and confirm that a muzzle isn't needed when you are doing this work, because as you get closer to the mouth, you might put yourself in jeopardy.
Right. Owners will bring a muzzle with them when they know that their dog can misbehave. And I haven't had any problems in my office because I think the dog feels that I'm trying to help them.
What's the most unusual treatment that you've ever had to administer or apply?
It was with a cat.
Oh, that's great that you're doing cats as well.
Yes, as well.
Yeah.
I do horses too.
Yes.
But it was with a cat, and the cat was rubbing its fur off, scratching, scratching, scratching to bare skin. And after a few adjustments, the mother told me the cat, Toby, is doing just great.